What do you think it is that tipped him off to go further with you, to keep searching?
The PSA,
The blood test.
that number.
What was your score?
At the time when they did it, it was like 6.
Had they checked it multiple times?
Well, when they first checked it, it was like 4.5. So it was
It was rising.
rising.
That's a scary thing when we see the rise in the PSA.
Yeah. So even when he was giving me the results, he says, look, your prostate was small, but it was aggressive.
It was going to go somewhere.
Yes.
It was going to act out.
Yes.
Yeah, we hear that there are some options, especially as men grow older, that if it is a slow type, that they can watch and wait, because prostate cancer can be less aggressive at certain points or in other types. But here it was, they were worried about this one.
Right, and even though it might be a slow moving something, it also causes complications.
Yeah.
So let us say that it's interfere with the urinary tract that caused the problem that I was having. Whether it's cancer or it's enlarged, you will get complications.
And so here we are, it's late August 2019. Prostate's out. Urination is better?
Very well.
Good.
Very well.
And that's what brought you to him in the first place.
Yes.
So now after you have the prostate surgery, what did he tell you about following up? When do you have to go back and get checked
Well,
again?
my next visit is not until, I think, the 2nd of February.
And they're going
like
to check
6 months.
check the PSA again?
PSA.
What about the rest of your health? You still seeing your primary doctor?
I'm seeing my primary doctor, but not for anything.
You feeling well?
I'm feeling good.
Cancer prevention is important. What is a message that you send to the men watching today about their prostate health?
I would like to encourage every male that is over 50 to get their prostate checked every year if it's possible. And don't feel ashamed or don't be afraid. Don't ask questions that scares you. Ask only the questions that has good answers. That helps you a lot.
I'll try to write that down for myself. So you're prostate cancer free now. Have you been checked for other cancers? Do you make sure to follow up with, like someone like me, like a colon doctor, to take care of the colon?
Well, I did my colon like 3 years ago.
How'd that work out?
And that was perfect.
You did the colonoscopy?
Yes.
How'd you feel about that? Was that a scary exam?
No. That was, to me, easy.
I think they're easy. I do a whole bunch of them every day, but it's another area of medicine where people sort of push off sometimes also.
I think it's all in their mind. And they tend to fake someone else's experience to fit it in their life even before they have an experience. And that's a danger.
Yeah, that happens to me at times in the office where I tell somebody that's, they're due for a colon cancer checkup, and I tell them the options, and they all, at times they pull out of the up the sleeve the story of a friend who they know who had some trouble with it, and we try to explain that there are thousands and thousands and thousands that are done every day without an issue. Sure, there may be some issues here and there, but they're quite rare. Prostate cancer is really, really common. Obviously, it only affects men. Anybody in your family have prostate disease?
I think my father claimed that he had his prostate done, I think it was 1997. He died only 2 years ago. Not even 2 years yet. December is going to be 2.
And he was living here? Or
no, he was living back in
St.
Trinidad.
Vincent?
No, in Trinidad.
In Trinidad.
Mm-hmm.
Okay. So tell us a little bit about yourself now. You're 64. It's the end of summer. What are your plans for the rest of this year?
I'm not the party type. Sorry.
Not the party type.
No. I don't drink, don't smoke. My thing is, I love craft. And I does a lot of craft.
You like working with your hands.
Working with my hands. Macrame is the main thing. I can make you a suit from macrame. I can make you a shoe from macrame. I can make you anything from macrame. And that's my spare time. I think that's one of the things that keeps me going.
We talked a little bit before about heading back to the Caribbean at some point to spend
That's
some time.
one of my goals, that I want to have a boutique.
A boutique?
Yes.
Down in St. Vincent's.
So I started to make these things up. I have over 400 pieces of different stuff.
You head back down
At
there.
the end of the show, I'll show you something on the phone.
Oh, you've got some of your crafts, huh?
Yeah.
You'll have to show me those. How's your diet? What kind of foods do you like to eat? What do you avoid?
Okay, well, I'll avoid red meat. Well, being a Seventh-day Adventist, I don't eat pork and shrimps and crabs and those stuff.
Right.
I don't have anything special that I have to eat. I avoid fatty foods and stuff like that, fried foods. But otherwise than that, I eat my ordinary food.
I need to write this all down because I want to have your spirit when I get older. I'm almost there, but I want to have your spirit. For our viewers today, Philip's a special guy.
Thank you.
We were talking before the show. He's got a lot of confidence, a lot of good personality, good spirit, and he's been through a whole lot, as we discussed earlier in the show, with his prostate cancer and his treatment at Kings County Hospital with Dr. Weiner. He's been through a prostatectomy, significant surgery in the pelvis to remove the prostate gland. He's cancer-free, back to life within a few weeks, and now 2.5 months out, he's got plans to open up a boutique in St. Vincent's at some point.
Yes.
Your diet seems to be pretty healthy.
Very good, yes.
You avoided smoking and drinking.
Yeah.
Exercise much?
Walk a lot, work a lot. That's it.
Keep active.
Mm-hmm.
And you said that you're not retired.
No.
You're just still going and doing all of your crafts and...
I'm going to say what George Jones once says. I'm only a little bit older now, but I ain't ready for the rocking chair.
I like that. I like that. As we get older, we get a bit more experienced. We become wiser.
Yes.
Unfortunately, we have to deal with our health, and it's important to get screened.
It's just that some of us never want to take the opportunity whenever we get it to take care of our health.
And not to be scared of that.
Not to be
Not
scared.
to fear it.
No.
These exams, I know it's difficult for men to fathom going into a doctor's office and getting a rectal exam to feel the prostate. It's invasive.
I can recall when the doctor says that she was going to order the biopsy, and I says, okay. She says, how do you say okay like that? I says, because a man have to do whatever a man have to do. Because she said a lot of people, comes in there and they make a big thing out of it. They don't want to do it.
Yeah, I can tell you, I'd probably be a little worried too, but I agree with you that it is what it is. That's what I try to live by also, is that this is what it is. We have to cross this bridge. And if we don't, you're not going to ever know. And it saved your life, that biopsy.
I think one of the things that we have to always remember, don't count the cost, count the profit. And this is what I have been doing. I'm not counting what pain I had. I'm counting now I have nothing in me that will worry me, that is growing in me and put me on a time table. I'm now stage 2 and I'm going to go to stage 3 and I'm going to hit stage 4 and then have one more stage. No, I no longer have to think about that.
Right. You cut it out.
It's
you
out.
went through the pain that it took to get the recovery and the pain. To quote a more modern rock star, you have to go through hell to get to heaven sometimes. And the term that we all use, no pain, no gain sometimes. And while going through a prostate biopsy may seem uncomfortable,
Just for the moment.
it's for the moment,
For the
but
moment.
it's for the rest of your life to prevent a disease or to detect a disease. And then the prostate surgery, you said you were out of the hospital the next day, and this gifted-handed surgeon who I've met before, and I have a lot of faith in. He's a nice man.
He is indeed a terrific doctor. As I said, he makes you feel very special and comfortable. So there is no fear.
Yeah, Dr. Weiner is a special guy, and he's got a nice team, as you said, over there at Kings County Hospital. Is that where you've gotten all your health care over the years?
Yes, Kings County.
Still following up there for the future until you go to St. Vincent's, and then who knows what we're going to do down there.
Well,
you got to bring Dr. Weiner down to the Caribbean.
When that time comes, God will take care of it.
That's the right way to look at it.
Yes.
So you have family at home? Who do you live with?
Here, I have a wife here. I have 3 kids back in Trinidad. I used to live in Trinidad, so
Right.
I do not have that raw Vincentian accent. It's sort of mixed.
I couldn't tell. I'm from New Jersey, so
Right.
now I know how to speak Brooklyn, though.
Well, that's good.
Family was supportive. How were they throughout the whole process? They handled
Very
it
good.
well?
Very good.
It's important to have a good support system at home.
Yes. As a matter of fact, as I said, I didn't consult with my wife.
You didn't consult with your wife?
No. I let her know what I was doing.
Was she worried about it?
No. She only says, do what you have to do.
Well, that sounds good. You have a good support. As I say, behind every good man is a great woman. And you had a good support system. You had a good surgeon. You had a good medical center. It's an honor to have someone like you on the show, because I could talk to doctors all day long. I don't know. Talking to patients to me seems a lot more inspiring.
I think it makes you, you get a joy in your heart when you talk to somebody who you honestly helped.
Yeah, I think so. Every time I remove a polyp from somebody's colon, I feel good. A smile's on my face that we prevented cancer. I'm sure Dr. Weiner feels the same every time he helps someone like you out and removes their prostate to cure them of this terrible disease, which is quite common. I want to thank you for coming on. I mean, this is a huge honor. I got to tell you, Philip.
I want to thank you too.
I won't forget
for
this.
the opportunity to
if I
share
ever
my story.
Hey, you can share your story anytime. We'll have you back on here, and maybe we'll bring the show down to St. Vincent's. We can talk on the beach over a little rum punch or something. I'll have a rum punch. You'll have an iced tea,
I'll
right?
have an iced tea.
An iced tea.
Or some coconut water.
Some coconut water. Mm-hmm. Well, I'm sure it's a lot easier now to go to the bathroom after all that coconut water after Dr. Weiner fixed you up. We got to send him a big thank you, huh?
Thank you, Dr. Weiner, and your team for doing a marvelous job on me.
Well, thank you, Philip. I want to thank you for watching this amazing episode of Medcastplus, because I had the honor of speaking with a patient of a local surgeon, Dr. Weiner, who is at Kings County Hospital. He's a prostate cancer surgeon. He does robotic surgery. He took care of our friend Philip, who is doing well. You can see us out on social media or get in touch with us through Instagram or on our website, medcastplus.com. You can follow me on Instagram at GIJack. You can reach us at 718-510-2103. I'm Dr. Braha, and from all of us at Medcastplus, thank you for watching and stay healthy.